In the second-line setting of advanced non-small cell lung cancer in the non-squamous population, there is a clear biological rationale for targeting angiogenesis. We know it's a critical factor in tumour growth, progression and poor survival. We know in the first-line setting that using VEGF-directed therapy such as bevacizumab can have an advantage, and we know now from trial data that targeting angiogenesis in the second-line setting can also give survival benefits. In the second-line setting, there are three potential anti-angiogenic agents: ramucirumab, nintedanib, and bevacizumab. Bevacizumab is the classic anti-angiogenic compound. It's a monoclonal antibody which is targeted against the growth factor VEGF-A. Ramucirumab is another monoclonal antibody, but rather than targeting the growth factor, it targets the VEGFR2 receptor, which is the main receptor that binds to VEGF-A. Nintedanib works in a totally different way. This is a tyrosine kinase inhibitor which acts on the kinase associated with a number of different receptors associated with angiogenesis. Specifically, it inhibits VEGFR1, 2 and 3, FGFR1, 2 and 3, and PDGF alpha and beta. All of these are important in the complex process that is known as anti-angiogenesis. When targeting multiple angiogenic pathways, you're giving a broader hit. The process of angiogenesis is really quite complex, specifically in tumours, and can be very context dependent. So there are different pathways that can come into force at different time points in the tumour's growth. Targeting all of these different pathways through one particular therapeutic approach, such as nintedanib, can therefore have good biological rationale. The three agents, bevacizumab, ramucirumab and nintedanib, have been used in different populations. Bevacizumab has really been evaluated in the first-line setting, particularly in the non-squamous population, because of safety concerns in the squamous population during development. Ramucirumab has been evaluated in the second-line setting and seems to be active with a survival advantage both in adenos and in squames. Nintedanib has been licensed for use in Europe for adenocarcinomas only, with a survival benefit in that population, which is underpinned by progression-free survival benefit in addition.
Anti-angiogenesis has become a very attractive instrument also for treatment of patients with advanced non-small cell lung cancer. And the first anti-angiogenic agent which has been approved in treatment of eligible patients with advanced non-squamous non-small cell lung cancer has been bevacizumab. However, we do see that in most patients there is a resistance following treatment with bevacizumab after a couple of months. We haven't really understood the mechanisms of resistance following treatment with bevacizumab. We have some data that there is a dynamic change of the pathways of angiogenesis that are activating following treatment with bevacizumab. So it makes sense to change the way to impact angiogenesis like it's done by nintedanib, because nintedanib is interfering with various pathways that are associated with tumor-related angiogenesis. And we have looked for the efficacy of nintedanib, in particular following treatment with bevacizumab. So we had a cohort of patients pre-treated with bevacizumab that received nintedanib at time of progression, and we have seen a consistent signal of efficacy also for these patients who have been pre-treated with bevacizumab. So for practical considerations, even if a patient has received prior treatment with bevacizumab, he also would be an appropriate candidate for the combination of nintedanib and docetaxel, for example. Talking about the optimal sequence of anti-angiogenic approaches, currently we have, I would say, the clinical avenue, and this is the first-line efficacy that we have seen for bevacizumab, followed by a differential anti-angiogenic approach utilized by ramucirumab and nintedanib. Whether we are going to see additional trials looking on other sequences, I am in doubt, because currently there is so much going on in the field of immunotherapy that people are not really interested in novel anti-angiogenic sequences. However, what we can say is that a sequence of different anti-angiogenic approaches is efficacious and is something which is real for practical considerations.